Hi. Through this video, we will discuss the cardiac cycle and its regulation, neural, and the chemical control. It is included in the Unit 3 of the 3.3 of Semester 1 syllabus of CC1. So, cardiac cycle, it is a rhythmic contraction and the relaxation of the heart and represent all events occurring during a single heartbeat, which is of 0.8 seconds. So, construction of heart is known as the systole, while the relaxation of the heart called as the diastole. So, showing the AV and the semilunar valves, as we can see in this picture, there is a right atrium, right ventricle, left ventricle, coronary sinus, pulmonary vein, systemic arc, and semilunar valves, and the left atrioventricular or the bicuspid or mitral valve, while the right atrioventricular or tricuspid valve. So cardiac cycle includes three steps. That is, first one is the atrial systole, which is of 0.1 second. Then the ventricle systole, which is of 0.3 second, in which the lub sound is appears, and isovolumetric contraction and the end systolic volume. Third one is the joint diastole, in which the both atria and ventricle relaxes, that is diastolic pressure occurs, and this seminal valve closes, produce second heartbeat sound, that is dub, for preventing the backflow of the blood. In the conclusion, we can see that the atria contracts for 0.1 second and relaxes for 0.7 second, while the ventricle contracts for 0.3 seconds and relaxes for 0.5 seconds. So, heartbeat. One complete pulsation of the heart causes the heartbeat or the heartbeat per minute. So, it is a rhythmic contraction of the cardiac muscles, and one cardiac cycle constitutes two heartbeat, corresponds to the vertical systole and diastole. So, in certain condition, the heart rate increases in fever, emotional condition like fear, happiness, etc. And the disorder causes the tachycardia, which causes due to the increased heartbeat, while the bradycardia caused due to the decreased heartbeat. So there is a term stroke volume, the amount of blood pumped through left ventricle to the systemic heart per beat, and it's about 70 ml. While the cardiac output, the amount of blood pumped out for by ventricle per minute. So cardiac output may be of stroke volume to the heartbeat, and is equal to 5 liter per minute. So neuroendocrine control of the cardiac cycle, that is nervous control by the cardioaccelerory centers present in the sympathetic nervous system, adrenaline, which raises heartbeat rate and forces of contractility of the heart, and the cardioinhibitory center, parasympathetic nervous system, where, when activated, released acetylcholine, which decreases the heart rate and speed of conduction. So, adrenal medulla secretes epinephrine and the norepinephrine, which increases the heartbeat. So, electrocardiogram is a recording of action potentials produced by the heart in each cardiac cycle, and the instrument used to record the changes called electrocardiograph. So, a standard ECG represented by the PQRST wave, in which the P wave represent the arterial depolarization, QRS wave represent the ventricular depolarization, while the T wave represent the ventricular depolarization. So this is whole about the cardiac cycle and its regulation. Thank you.